Just have a wee seat. I'll be with you in a second, okay? Unbelievable. Right. Can you please just confirm your first and last name so that I make sure I get this right? Okay. It's a good Irish name. Is it Irish, is it? Scottish. Good Scottish name. Good Scottish name. Not that it makes any difference. I mean, it might a wee bit in terms of the level of care that I give you. No, I mean, just ignore that. So, now, tell me, what's been happening? Right. You're feeling a little out of it. Yeah, I gathered that. And it makes sense. It appears, according to the forms that you already submitted to come here, that you've been getting an awful lot of cranial nerve exams lately. And I say lately, but this goes back 2 years or more, depending on how truthful you've been when you submitted your forms. Look, I'm not here to judge. It's fine. You're fine. But the symptoms that you're experiencing, especially around your eyes, I can tell just by looking at your eyes that things are not as they should be. Yeah, I think it's safe to say that you've gone a bit overboard with these cranial nerve exams. Am I right? Yeah, you don't know. Did you know that there is considered to be a safe limit per year for cranial nerve exams, especially good ones? I mean, the potent ones, you should not be having any more than, I mean, it's hard to put a definitive number on it, but I would say no more than 4 or 5 a year. And according to your records, we are looking at, let me just double check this number, because I mean, obviously you don't remember them all, but that in itself is cause for concern, I would say. Look, don't panic. You're going to be fine. That's why they sent you to me. You're going to be fine, but I need to make sure that all this stuff is 100% accurate, or I cannot administer the treatment. Okay. 66. Does that sound about right? 66? In the last year alone. Is this one of these things where, you know, the doctor asks you how much you drink a week and you're like, oh, I only have maybe 3 or 4 at the weekend, you know, and we all know that's bullshit, don't we? And turns out you actually have, you know, 44 at the weekend. Maybe not that much, but you know what I'm saying. Is this one of these instances? It's okay. Like I said, I'm not here to judge. But if you can give me an indication of the, for lack of a better word, damage that has been caused by these excessive cranial nerve exams, then I will know just how much I need to set my equipment to fix it. Okay? Now, there is one other thing before we get on with the treatment. There's one other thing I would like to mention. Now, you wrote down 3, 4, 5, 6 of the last you wrote down 6 of the last doctors that you saw for this, and I wanted to just double check these, okay? Because I did some Googling. Dr. Seafoam, Marno, articulate design. See that? Did you accidentally put in the name of your architect or builder? Because that's what that sounds like to me. No? Articulate design. Okay. It really is. Okay. Jelly bean. Ginger. Okay. I mean, look at this one. Shortbread. Are you telling me you went to a doctor and got a cranial nerve exam from somebody called Shortbread? Look. I'm going to be honest with you, alright? I did some digging, even though I would say by the names on this piece of paper, I would say it's pretty obvious. And there's no gentle way to say this, so I'll just say it. None of these people are real doctors. Not one of them. You've been scammed. I'm sorry. I'm sorry to be the one to break that news to you, but I couldn't find any of these names, as ridiculous as they sound. Jelly bean. In the database of accredited doctors who give out the world famous cranial nerve exam, none of these people are in there. You, my friend, are extremely, extremely lucky to be sitting here right now. Who knows what could have happened? Any of these cowboys could have turned your brain to scrambled eggs. Have you seen the original Total Recall? They always talk about getting lobotomized. Well, it's not quite the same as that, but it's close. You got very, 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 very lucky. So, well, you're here now, and I'm here to help you. It's my job, okay, to reverse some of the damage that may have been done primarily via your optic nerve, okay? So, we'll move on to the treatment. Now, this is not without risk, okay? There is a small possibility that I could create slightly more damage to the optic nerve, and thereby obviously the brain, because it's connected, right? And it's a pretty small chance, less than like 6%, okay? But I feel like it's the responsible thing to do to tell you that. Now, you need to make sure about this. One, these doctors are cowboys and what they've done is highly illegal. Two, what I'm about to do to reverse it is even more illegal. I have a specially modified infrared laser system here which will penetrate through your optic nerve. Think of it like laser eye therapy, but the frequencies that have been programmed into this device are specifically designed to reverse the damage that has been done by the excessive and illegal cranial nerve exams. Alright. So are you okay to just go with me on this? Yeah? Shall we do it? Okay. Now I will be administering it in short bursts because we don't want to push it. Okay, we don't want to go crazy. We want to make sure that we start low and build our way up. Now, you can see, program that. 2 milliwatts to start. Now, I need you to hold your head perfectly still. Okay? I'm going to be coming at you from a couple of different angles. Your left eye to your right eye, and then back to your left eye. Okay. Is everything all right? Okay. Stand by. Okay. It's hard to tell from just 2 bursts, but if I was a betting man, I would say that we're already in the right area, in the right power. But given that I'm short of time and so are you, I'm going to turn it up anyway to 3 times the power. Now we're talking. Here we go. Shh, alright, it's alright. Don't panic. It's fine. It's fine. Yeah, now we're getting somewhere. Now I might have burned a wee bit of your cornea there, but it should grow back fine probably in a couple of months. There we go. Alright, maybe I should turn that down slightly. Okay, alright. Let's go with 450. Okay, you can still see me okay, right? I haven't completely blinded you yet, have I? I'm just joking, I'm not going to blind you. Alright. That's good. It's very good. I can see that things are starting to clear around there. How does your brain feel? How does your mind feel? you look around, does it, the things seem a bit more centered? You can't see because you've got red, because I just blinded you with the laser. Right, okay. I get that, that makes sense. That'll probably be there for a wee while. Let's just carry on, okay? 1, 2, there we are. Oh, that's beautiful. That's really good. I think we're starting to get somewhere now. Let's just try that again. Alright, let's give that a rest for a second. Let's hope that we're not going to need to do any more of that, hopefully. Shh, it's alright. I know that it's not every day you have to be treated for overdosing on a procedure that's supposed to be nice and relaxing. But we don't want your brain to turn to jelly, like I said, the scrambled eggs. Shh, it's alright, I'm just going to press very gently on your eyeball. Right, I can see the veins pulsing away. They're definitely, I think, reconnecting and rebuilding this, I was going to say the synapses, but whatever they're called. You know, it's been ages since I've been to medical school, and I forget a lot of the terminology that we use. You know, it doesn't matter. I mean, I know exactly what I'm doing, so it's fine. But yeah. Shall we do one more blast with a laser? Can you recall things better now? How's your brain? Brain all right? Yeah. Do you remember what you had for breakfast yesterday? What, about 2 weeks ago? I'm just joking. I don't remember that either. Just gonna wait it out for a few minutes to see if the blood vessels start to calm down a little bit. There we go, little blood vessels. Little blood vessels, just take it easy. You can still see my finger, right? What about now? No? What about now? Yeah? Yeah. Okay. Can you, yeah? No. Okay. It seems to be that the width of your vision has been compromised slightly. Is it any narrower than it was when you came to see me today? No? So, okay. Well, thank goodness for that. That means that it's not my fault. I mean, that means it probably happened when you visited one of these other people, these cowboys. Yep. That's probably what happened. Okay, I think, you know what, I think we've probably got enough of a margin of safety to just blast the eyeballs one more time with the cranial nerve exam overdose therapy laser. Let's just do it, shall we? Let's just go for it. Is that cool? Okay. Give it a good dose, good measure. That's going to repair the optic nerve. That is going to send and refresh all those signals into the brain. Yeah, that's great. Let's just do a bit more. This is fun. This is great fun. Okay. Oh. Maybe it's a little bit of redness there on your right eye. I'm sure I'll be fine. Look, I can't promise you that you're going to be better overnight. Okay, I'd love to, but I can't. So, let's leave it like that. If you like this therapy, come back and get some more. If you didn't like this therapy, because it's not exactly legal, okay? And I would appreciate it if you just kept quiet about me. Alright? Okay. I think we should leave it at that. Yeah. If I were you, I'd be very, very careful who you get your cranial nerve exams from in the future, and also don't go overboard with it. Okay? You can have too much of a good thing. You actually can. Use your head. Good. I'll see you later.